And I want to piggyback off of what Adam and Samantha were talking about when we talk about certain residents. So my name is Leon Wilson. I'm the Chief of Digital Innovation and CIO at the Cleveland Foundation. And for those of you who don't know who the Cleveland Foundation are, because those who know us probably know us, and those who don't know us don't know us. Basically, we're your community foundation. We're the ones that are providing massive philanthropic dollars to help improve the quality of life of Cuyahoga, Lake, and Geauga County. But for the most part, we kind of concentrate a lot of our investments and our philanthropic and grant-making dollars into the greater Cleveland area. In that light, part of what my job is to better understand and ascertain how does this whole conversation about data, open data, public data, digital inequities, and so forth matter to an organization such as the Cleveland Foundation, so that we can then provide the financial dollars to support massive type of transformational efforts and so forth. Now, with that, you hear a lot of conversations where Samantha was talking about, well, you have the elderly who are not as mobile, who can't get around, who don't have access to things of that nature. That impairs their quality of life. And when you exacerbate that with they may not have a computer in the home, they may not be able to be connected, or they can't pay for the high-speed internet access that they desperately need, because let's be honest, what can you really do with 3 megabits? I mean, for the most part, whatever you can do today, you're not going to be able to do it on 3 megabits a year from now, because everything keeps scaling exponentially when we talk about the internet and the dispensing of information, the access, the interaction that goes on. What we were able to do with our 24 by 4K baud 15 years ago, we can't do today. So we got to think about that when we talk about access, is that it's an ever-pressing issue that we just can't, it's not a one and done thing. If we stop, then we're taking our foot off the gas pedal, and we're not keeping up with where we need to be a year from now, 5 years, and so forth. And what Adam mentioned about where he talked about, well, those who have access and access the information portal, the MyChart Healthy portal, are more informed and are able to make healthier life decisions and so forth that impacts their health outcomes and so forth. Well, that makes sense. The more information you know, the more you know, unless you're dealing with alternative facts. I got to get a joke in once in a while. The more probable, because there's always irrationality in any kind of decision-making and judgment, but the more probability is that you're going to be more informed and so forth. Well, how are you getting access to information? Whether it's healthcare information or other sorts of information, again, if you're impaired with your connectivity and your access to information via the internet. So as I look at what's going on with what I call the digitization of society, and how various industries and various sectors are being basically incentivized to push and propel and move towards a more digitally engaging environment and experience with their constituents. Whether you're talking about kids in a classroom and you have the digitization of the classroom with the dispensing of educational material electronically, and then trying to do homework at home without internet access at home, whether you're talking about the digitization of currency. Now, we're not there yet with the Bitcoin things, and it's out there, but even trying to do things like transportation with Uber and stuff like that, where you got to have a credit card on file, and then you're basically using your smartphone in an app to request services and so forth. So you have this digitization of the currency. You have this digitization of schools. You have digitization of healthcare systems, where they're trying to go to electronic healthcare records and try to eke out any kind of inefficiencies in the healthcare system. I worked at 2 different Blue Cross Blue Shields in 2 different states, and I can tell you from processing claims and gathering information and so forth, that is a big deal as far as everything's going electronic. Well, if the whole world is going electronic, and that is also dealing with healthcare, if the whole world is going electronic, but we have a population of individuals, whether they're low to moderate income, whether they're coming from different places in Cleveland or Cuyahoga County or so forth, that are impaired with their digital access, that are impaired with their digital literacy, or they're impaired with the tools that they need. Because just because everybody is walking around with a smartphone, every phone isn't as smart as you think it is. So what can they really do? We're basically leaving those folks behind. They're becoming unconnected, disconnected. They're less connected. And with that, then you're going to find out ripple effects. So I'm extremely interested in how that plays out when it comes to healthcare. It affects everything else that we do in our lives, to how we pay our bills, to how we shop, to how we travel, to how we help find our kids, how we find our own housing, how we help our kids with homework and so forth. You got to believe that there's some kind of health impact with all of this if we're not dealing with access to information. As well, when you look at what's going on with things like wearable devices and what kind of data are we sharing and generating, just living our lives. Half of you probably walking around with a Fitbit or some variation of a Fitbit. A lot of you are maybe just using different apps and devices on your smartphone to track and control your mobility, your activities, your comings and goings and so forth. And that information just going up into the ether, being collected by the Metro Health, being collected by various public agencies, being collected by other folks to help try to better inform how to provide better delivery of services to you all. So in this light, in the spirit of data days and open data and public data, then we need to be mindful of that and say, if I'm generating just by living, just by waking up and getting out of the bed and going about my business, I'm generating data. I'm a data generation machine that's going out to being collected and being tracked and so forth, then how is that, who is managing and who is controlling, who is mining that information? How is the city providing better services and delivery services to me through data information sharing agreements and through data access to what I need as a resident of Cleveland, as a resident of Cuyahoga County versus what they need from me? What am I doing as far as public access and sharing agreements and so forth, or transparency, Freedom of Information Acts and things of that nature, so that if I want to be a more informed citizen, how do I go about doing that? When you talk about health inequities, so Samantha talked about the mental state of individuals has a health impairment on you. Well, don't I want to know what kind of crime's going on in my community? Don't I want to know what else is going on in my community? How will I not know that if I'm not able to stay readily accessible to that information? That will start comparing me, start affecting my depression state and things of that nature. So I'm really curious about this, but when I have to understand and try to distill this down so that we, the Cleveland Foundation, can determine how best to support, fund, and things of that nature, you have to understand who I have to sell this to. So who's on my board? Yes, I have people that are that are pastors of their local church or that are activists in the community. But then I have business professionals like Bernie Marino, who's the owner of Marino Automotive, the luxury automotives, or Paul Dolan, who's the owner of the Cleveland Indians. How do I distill this issue down to individuals like that to say this is a real issue? And we need to earmark dollars to help ensure that we are providing the necessary tools and resources so that we can improve the healthy outcomes of residents throughout Cuyahoga County and Greater Cleveland. So that's why I'm really interested in this. And again, if you have any what I call meaningful life scenarios that you want to share with me so I can explain it in plain English, why we should be concerned about this as a foundation, so that I can say, hey, Paul, just like Moneyball and tracking and collecting data to better determine what kind of athletes to go after and so forth. We want a Moneyball scenario going on here regarding healthy outcomes, dealing with data. He'll get that because he can just correlate that to, oh yeah, that's why we made it to the World Series. So now I want to get Cleveland to the World Series. We've done a lot of great things with bringing the RNC here, bringing other things going on here, and we're doing some great things underground. But again, where do we get that World Series kind of continuous momentum here in Cleveland? And it's going to be through data. It's going to be through access, but it's also how we use that data to support things like healthier outcome, health inequities, economic disparities, and so forth. So that's what my charge is at the foundation, so I'm always willing to talk to anybody, listen to anybody, but anything you can do to help me explain it like a 6-year-old to activists and also businessmen and women, lawyers and attorneys and so forth, about why this matters, why is this relevant, the more likely you will start seeing those dollars go to those desiring programs. So, thank you.